Good morning, everybody. Hello, and welcome to today's session on CDBG and CDBG-CV Community Violence Prevention Part A. I'm going to be going over a couple of housekeeping items before we start the presentation and panel discussion. We are using a PowerPoint presentation, and the webinar will be recorded and available, as well as the PowerPoint will be available on HUD Exchange after the conference. Participants are in listen mode only, so we cannot hear you speaking. Closed captions can be viewed using the Show Captions feature below the video player. And please consult your attendee guide for any troubleshooting tips. You can submit questions throughout the session. You don't have to wait until the end to ask questions. We will be accepting questions. We may be announcing them ourselves and asking those questions to the speakers. Please use the Q&A box below, as you see here, to submit your questions. We'll also be doing polling throughout the session in the first half of the session. To answer the polls, you can go through the polls button and then click on the poll. As you scroll down, however, if you have not or you're not used to this system, if you scroll down in your web browser to view the question and answer and polls, the video may stop, but you can still hear the presenter speak. If you want to prevent that, you can download the Slido app on your phone or smartphone, or you can go to sli.do and enter the activation code or the key code that's shared in the chat feature, in the chat box. So I'm Orlando Velez. I'm one of the HUD TA consultants working with Enterprise from Enterprise Community Partners. Now I'm joined today by my colleague Chris Andrews, another HUD TA organization, MDG Associates. We'll also be joined by two members from HUD, from the Office of Block Grant Assistance, OBGA, Julian Nidiger Gonzalez and Gloria Coates. And then at the end of today's session, we'll be joined by Susan Au, Senior Planner from Tarrant County Community Housing and Development from Tarrant County, Texas. So today's learning objectives, participants are going to go over the CDBG-CV, community violence, and COVID-19 quick guide. We're going to be going over some of the key ways to mitigate violence through using CDBG-CV, improve the physical environment of neighborhoods, reduce substance abuse, increase financial stability and mobility, and engage and support youth, and focus violence intervention and deterrence. Then we'll be going into the panel discussion panel. After today's session, we'll be doing part B at 11:15 a.m. Eastern Standard Time. We do encourage everyone to join that session because it'll be a second half of this conversation, where we'll be joined by panelists that'll talk on topics such as housing support services and gender-based violence, workforce training and employment, parks and public infrastructure, survivors of domestic violence. This is a great panel discussion from grantees and sub-grantees on what they're doing in their communities to help mitigate violence. In April of 2021, the White House announced strategies in investing in community violence intervention, CVI. This included an outline on leveraging existing grant programs across 5 agencies to direct support to CVI programs. And as part of this, HUD was tasked to publish the CDBG-CV Community Violence Intervention Quick Guide, explaining how CVI activities can use CDBG funds. Before we jump in, we're kicking off the session with a couple of questions. As mentioned before, you could either download the Slido app, scroll down to your screen to open a separate browser and follow sli.do and put in the code provided to you in the chat feature. And now we'll open the poll, and I'll ask Chris to read out some of the poll questions and results after the poll is closed.
Great, thank you, Orlando. We'll give folks about 20 more seconds to respond to the poll. Have you used CDBG or CDBG-CV to address community violence in your jurisdiction? Great, and Orlando, we're going to close the poll. It looks like a little under 30% have used CDBG or CDBG-CV to address community violence, and about 70% have not.
Okay, great. That's wonderful to hear that people are excited and here to learn about the CDBG-CV program and how it can be leveraged for violence mitigation. Thanks, Chris. According to the CDC, US adults reported considerably elevated mental health conditions associated with COVID-19. Younger adults, racially ethnic minorities, essential workers, and unpaid adult caregivers also reported experiencing disproportionately worse mental health outcomes, increased substance abuse, and elevated suicide ideation during this time. Researchers and journalists have identified various ways in which community violence has been exacerbated by the pandemic. Factors correlated with community violence that have become more pronounced during this pandemic include homelessness, social isolation, anxiety, depression, and other mental issues, substance abuse, lack of economic opportunity, and neighborhood blight. This is a very difficult time. Of course, we don't have to repeat that. We all are experiencing it together. Community violence does not result from one single action. It's the product of multiple factors at all levels of community. And these factors have been exacerbated as the result of the pandemic. Actions should be taken to understand and counter the root causes of the violence in your community. And this graphic here, created by the National Center for Injury, breaks down the root factors into 4 broad categories. One is individual, its own experience of normalizing behavior, both at home and in the community. The second is societal, implicit and explicit messaging that accepts violence and lack of policies and programs to provide assistance in under-resourced neighborhoods. The third, community. Poor community conditions, including limited or poor housing stock, unstable housing, underemployment or unstable employment, and lack of community connection through programming and engagement. And the fourth one, relationship. So increasing stress at home, in partially because of other factors listed here, can lead to more conflict and stress at home, resulting in less availability to have a safe and supportive space. The Urban Peace Institute goes on even further, looking at the root conditions of community violence with the perspective that any one of the factors, if not properly addressed, can result in conditions of community level violence. These conditions are extensive and can be broken down into 5 broader categories, more so. Many of the conditions overlap. So gang intervention and service, smart justice, prevention services, law enforcement, re-entry, and transitional services. And in these root conditions, you can see activities that can easily be often addressed leveraging CDBG dollars, such as poor access to health, mental health care services, lack of economic investments, and educational support. And CDBG can also be used to address other root causes or conditions created by creating community cohesion, such as neighborhood centers and services, creating stabilized housing, and establishing and promoting community policy policing mechanisms. And when leveraging your conditions of community violence, you will find, as mentioned earlier, leveraging multiple sources funding sources is really key to a more holistic approach in addressing the issue. So I'm going to look to Chris Andrews, my colleague, to start a word cloud. And we can go to the word cloud. If you can scroll down and see the word cloud on your web browser, or if you have the Slido app, you could join that way. And I'll ask Chris to read some of the word cloud, what we're seeing here.
Great, thank you, Orlando. We'll give everyone a minute or so to respond to the word cloud poll. So please take a moment to fill that out. We'll give you all about 15 more seconds to respond to the word cloud. And I see responses still coming in, but I will share with the group some of the more common themes that we're hearing. Poverty, lack of economic opportunity, mental health, prevention services, economic disparity. And we will keep this word cloud open for a little bit, and you all can keep on responding to it and adding to it, and you can see the results through the course of the presentation. Thank you all.
Thanks, Chris. And now we'll be transitioning over to discussing some of the strategies highlighted in the quick guide, improving the physical environment of neighborhood, reduce substance abuse, increase financial stability and mobility, engage and support youth, and focus violence intervention and deterrence, excuse me. And I'll now pass it to Chris to start us off. Thanks, Chris.
Great. Thank you, Orlando. Thank you, everyone, for being here this morning. I know for many of you, it is very early, so I'm glad you're joining us with your coffee to talk through different strategies for community violence intervention. As Orlando said, the second half of this morning's session, session A, will be a panel discussion. And then all of session B will be a panel discussion as well, kind of allowing us an opportunity to go into much more detail and hear from your colleagues and your peers who have carried out and designed and implemented and evaluated very effective and successful community violence intervention programs. And so please do make sure to stay through today's session and or this morning's session and to be back for part B. I will, as Orlando said, I'm going to be walking through the first 4 strategies that are in the CDBG-CV and a quick guide to reduce community violence. The first strategy is improving the physical environment of neighborhoods. And there have been a number of studies that have found a correlation between improved or increased public space and a reduction in community violence. I think more broadly during the pandemic, we've seen the importance of quality public spaces. I know that I have taken advantage of spaces in entirely new ways where it can be safer to socialize and safer to engage in activities, some of which we used to do indoors. So I think when we're thinking about improving the physical environment of neighborhoods, we should also be thinking about kind of the many positive impacts, not just on reducing community violence, but on improving community resources, improving community cohesion, and social connectedness. Next slide. The first two strategies that I will focus on are on improving and creating green space. And I think in thinking about improving the physical environment of neighborhoods, and especially in thinking about green space components, it's really important to think about partnerships with other city or county agencies, with nonprofits, with neighborhood groups, all that have a shared interest in an increasing green space and improving green space in the community. That can provide for both an opportunity to be leveraging other funding that may be available through other federal programs, state programs, or local programs. But also when we're thinking about improving and creating green space, it also is an opportunity to work with neighborhood groups that may be able to provide sweat equity, right? Kind of looking at the picture we have on the screen, and there's a lot of labor that can go into kind of improving green space. And you may find partners that are able to contribute and partner with you by providing kind of donated labor or donated time or donated materials to support that improvement to the physical environment of the neighborhood. The first strategy is increasing tree coverage in green space. And there's been a growing body of studies that have found an association between more urban green space and reductions in community violence. And gun violence has been found to be less common around vacant land that has been cleaned and greened. In the example we have on our slide, in New Haven, Connecticut, a recent study analyzing tree plantings found that just a 10% increase in the number of trees planted in the tree canopy resulted in an even greater correlation in crime reduction, seeing a 14% decrease in property crimes and a 15% decrease in violent crimes. A similar study in Chicago found that more vegetation was associated with a decrease in violent crimes in those neighborhoods that were greened. The second example is converting vacant lots to public spaces or community gardens or open space. And a number of studies have also looked at community gardens and greening of lots. And all of these studies have suggested that these interventions or the presence of community gardens were related to a reduction in crime. On the contrary, when left untreated, the vacant and blighted urban space contributed to increased violence and increased fear. And further, these projects can have additional positive externalities beyond crime reduction. Through a community garden, you can be addressing food insecurities. You can be creating park and open space, recreational space for youth, neighborhood groups, seniors, and increasing neighborhood and community pride. In the example we have on the slide, in Philadelphia, through their Green 2015 initiative, is actively working to transform 500 acres of underused urban land to both reduce crime and also create more productive green space. Next slide. Physical improvements are not limited to green and open space, but can also include improvements to the built environment. And the first example that we can talk about is improving street lighting. This may include brighter lighting. It may include additional lighting, depending on your needs. And at this point in 2022, there's significant and great lighting technology that can help direct lights to the target area, while not significantly contributing to light pollution in your area. In a study in New York City Housing Authority, a study of nearly 40 public housing developments found that increased lighting led to a reduction in index crimes being serious felonies and some property crimes. The reduction was at 36% that took place outdoors at night, and a 4% overall reduction in those index crimes. The second improvement that we'll talk about is reducing traffic congestion or improving pedestrian space. Both roadway and traffic control enhancements have been shown to increase safety and decrease opportunities for crime. Cul-de-sac streets are safer than other street layouts, not just for preventing auto accidents, but also in reducing the prevalence of community violence. In an example in Dayton, Ohio, barriers in local streets reduced traffic accidents in those areas by 40% and reduced overall crime by 26%. In another example, going back about 30 years, LA Police Department used traffic barriers to create cul-de-sacs in some neighborhoods to decrease gang violence. That intervention led to a 20% decrease in violent crime within a year of the program implementation. And improving street and pedestrian space, both through design and lighting, also reduces the fear that someone may have for their own personal safety. And that fear can result in people going out less, choosing alternative methods of transportation, and engaging in their community in a less frequent, less involved manner. And so by reducing that fear, you're able to bring kind of more members of your community out into it to be engaging on a regular and full basis. Next slide. So now in thinking about these different strategies that we've talked about, we'll just take a minute to tie them back to how they can fit into a CDBG or CDBG-CV programming. Increasing tree coverage or green space, your COVID tieback could be increasing suitable outdoor space for residents, and that could be done as a public facility or as a street improvement activity. Converting vacant lots to public spaces or community gardens, again, could be increasing outdoor space for residents. If you're converting the lots, that could be a public facility or improvement. It could also be a public service if you're assisting with a nonprofit that's operating a community garden. And then in thinking about reducing slum and blight and vacant properties by reducing and preventing evictions and foreclosures, you can be stabilizing households through subsistence payments, through mediation, or through housing counseling activities, and are all eligible with CDBG or CDBG-CV. Next slide. In thinking about the built environment, improving street lighting that can increase access to outdoor space. And when thinking about a tieback, same with reducing traffic congestion or improving pedestrian space, you're increasing people's ability to be outside. And both of those can be public facilities or improvements or street improvements. And then finally, through planning, you can increase social connectedness among neighborhood residents. Now, as you're thinking about what interventions, just as we did the word cloud a few minutes ago, you can be thinking about with your neighborhood, with your community groups, what are their needs? What do they want to be addressing and how do they want to be addressing it? And using a portion of your planning and admin allocation to think about that holistic community planning to be addressing community violence. Next slide. The second strategy that I will talk about today is reducing substance abuse. And there have been a number of studies that have found a strong relationship between increases in substance abuse and community violence. Additionally, substance abuse has a number of negative externalities that can impact our community and our communities through significant healthcare costs, intimate partner violence, fear and safety at the neighborhood and at the individual level. And addressing these in a holistic manner can better serve the individuals who are abusing substances and reduce community violence in a more sustainable, long-term fashion. And so we'll talk about two different strategies. Next slide. The first strategy, thinking about substance abuse treatment services, and the second, thinking about mental health services. When considering kind of any substance abuse strategy, this again becomes a really important time to be thinking about partnerships with your local and regional stakeholders. If you are in an urban area with multiple jurisdictions, this may be an opportunity to create a regional strategy that's not bound by your city or county borders, but is instead looking at the issue in a holistic manner in the metro area. Services and programs can range in cost, but regardless of the intervention type, you can experience positive impacts by focusing efforts to reduce substance abuse, some that can be done for relatively low costs. The first strategy, thinking about substance abuse treatment services and facilities, there are a significant share of state and federal prisoners who are in serious psychological distress or have a history of mental illness, many of whom who have or are using substances as a form of self-medication. A recent National Bureau of Economic Research study found that opening substance abuse treatment centers caused a reduction in both violent and financially motivated crimes. The study found that each additional treatment facility reduced the social cost of community violence and crime in that area by about $4 million a year, and the operating cost of those facilities was about $1 million a year. The example we have on the screen is from Suffolk County, New York. The county established the County Drug Treatment Court as an alternative to incarceration for drug abusing defendants. The program provides treatment and education, as well as case management, mentorships, and supervision. And through the program, recidivism has been much less likely for participants. The second strategy is thinking about an approach to mental health services and using the Substance Abuse Mental Health Service Administration, SAMHSA model of what's called sequential intercept modeling, which helps communities to identify resources and gaps in their service model and to establish local strategies to divert individuals who may have mental or substance use disorders away from the justice system and into treatment program. And the program establishes intercepts for intervention throughout the course of service. The first intercept being at the community service level, an opportunity to divert people into local crisis care services without requiring those individuals to be calling 911. The second intercept at the law enforcement level, if or when 911 is called, that diversion is performed by those law enforcement and other emergency service providers to be diverting that individual into treatment instead of potential arrest. The next intercept is through the initial court hearings and initial detention, and that would be diverting that individual to community-based treatment, either through the services within the court or to a different program, such as the example in Suffolk County, New York. The fourth intercept is through the criminal justice system by providing community-based services within each prison facility. The next intercept is during reentry and supporting reentry through comprehensive wraparound support, helping to connect to peers, to support groups, to job training, to economic development activities. And then the final intercept is continuing to provide those wraparound services through an individual's life cycle in need of assistance. Next slide. So how can these strategies fit into CDBG or CDBG-CV? Either substance abuse or mental health services, those can be conducted as a public service activity. A health facility or substance abuse or a mental health facility, you can acquire, you can construct, you can rehab, any of those, and those can be conducted as a public facility activity. Next slide. The third strategy that I'll talk about is increasing financial stability and mobility. And there is a strong correlation between financial instability and violence, especially when you're looking at intimate partner violence. Studies have found that households experiencing food or housing insecurity are significantly more likely to experience some form of intimate partner violence, when normalizing for other socioeconomic conditions or demographics. And so thinking about food insecurity and housing insecurity, both have been incredibly high over the past nearly 2 years of the pandemic. Feeding America in 2020 found that 1 in 7 people experienced food insecurity at some point during 2020. And that included 1 in 5 or 20% of children. Likewise, the Consumer Finance Protection Bureau found that that those at least 3 months behind in their mortgage increased by 250% to about 2 million households, and 8 million rental households were behind in their rent. Next slide. CDBG-CV has been used to provide a range of financial stability and mobility assistance to low and moderate income individuals and households impacted by COVID-19. These programs have helped to address food and housing security needs similar to those that I just described. The 2 examples that I'll go into in a little bit more depth here are thinking about job training programs for individuals with consistently higher levels of unemployment and food assistance needs. A need for job training for employment for certain individuals, including previously incarcerated, who have a high risk of employment, has been a consistent need and continues to be a consistent need. There is an association for those individuals between their unemployment and the potential for recidivism. A job training program can greatly increase access to high-paying living wage jobs in the community, which will reduce the likelihood of recidivism. A project example in Brooklyn, New York, called the Community and Law Enforcement Resources Together program, is a reentry program that provides both substance abuse treatment, but also employment and housing services for parolees. The program has effectively reduced recidivism among its participants by providing them with the tools and support and access to jobs and job skills needed to enter the labor market and establish stable housing and living environments. Thinking more generally, there was a study at the beginning of the century that evaluated prison records for 4 million individuals. The study found that higher wage employment reduced recidivism for first-time offenders in a very significant manner. The second example, thinking about food assistance, as I just described, the need for food assistance and levels of food insecurity hit a very significant high in 2020. Ensuring community members have adequate food not only reduces the impacts of intimate partner violence, but can also lead to reductions in crime and theft at grocery stores. Research has found that by staggering SNAP benefits over a series of weeks versus a single monthly benefit, crime at grocery stores was reduced by 17.5%. Similar findings have showed that theft in grocery stores is lower in the 2nd and 3rd weeks following receipt of SNAP benefits, but increases in the last week of the benefit cycle, most likely due to resource constraints. Next slide. So again, thinking about how can CDBG or CDBG-CV be used to be addressing the strategy in addressing housing instability. You can reduce or prevent evictions by providing emergency grant subsistence payments that may be used for rent, they may be used for utilities, they may be used for mortgages. You can provide mediation or housing counseling. Food assistance through food banking or other type programs can stabilize households and be carried out as a public service program. And then employment and job training can be carried out most frequently as a public service activity. It can also be tied to an economic development activity. Next slide. And the final strategy that I will talk about today before turning it back to Orlando is engaging and supporting youth. By engaging and supporting youth, you are creating alternative activities for those youth to be engaging in. You are providing skill training. You can be providing job training. You can be providing mentorship and supervision and support for those youth, all of which can be tools to reduce community violence. Next slide. So in thinking about two different strategies or approaches to be engaging and supporting youth within your community, the first is constructing or rehabbing a park or community center space. These are spaces that are designed to be supporting and responding to the needs of the community. And neighborhood institutions, they are core components of bringing our communities together. A community-oriented nonprofit can establish or strengthen ties between residents, between individuals, between different groups, and increasing that social cohesion and social control. In looking at communities that have been impacted by a disaster event, a hurricane or a tornado, communities that have higher levels of social cohesion, they respond faster, they build back faster, they build back more equitably, and they return to their pre-disaster norm faster than communities that had a lower threshold of social cohesion. Building off of that, thinking about the direct impact on community violence, kind of the data point that we have on the slide is a study in larger cities that found for every 10 new community-focused nonprofits, it produced a net positive impact on crimes in the area, and reducing the homicide rate by 9% and the violent crime rate by 6%. The second strategy of engaging and supporting youth can be done through workforce development or job training. And this is an alternative to the example of a job training that I just provided. But job training programs for youth can also have a positive impact on violent crime. In Chicago, participants in the One Summer Plus program, a summer job program for high school aged kids, they were less likely to be involved in violent crime. A participant reduction of 43%, there was a participant reduction of 43% in violent crime compared to those youth who did not participate in the One Summer Plus program. There have been similar findings from a multi-year study of Boston Summer Youth Employment Program. That study found that among participants, violent crime dropped by 35% and property crime dropped by 57%. And in both of these examples, the majority of the reduction in violent crime occurred after the end of the program. Next slide. So again, thinking about how can these activities be carried out with CDBG or CDBG-CV, you can use CDBG or CDBG-CV to be constructing or to be rehabbing a park or a community center space. You can provide youth services as a public service activity, creating more spaces or shifting activities that may have been done inside and now having them be carried out in an outside, in a safer setting. And you can provide job training to individuals. You're supporting those summer job training programs as a public service activity. I'm now going to turn it back to Orlando to talk through the fifth strategy, focused violence, intervention, and deterrence.
Thanks, Chris. Earlier, as you were speaking about outdoor spaces, I'm reminded that we've lived in this house for 7 years, and it wasn't until COVID hit that I actually got to know all my neighbors much more intimately, and got to know my neighbors. We used outdoor space in such a different way, and really connected with the community, which really draws on how powerful the community can actually be when it's all mobilized, especially as what Chris had mentioned earlier. In the next few minutes, we'll take and highlight a couple of strategies that communities can do to really focus on violence intervention deterrence. Two strategies that we'll cover today will, for the quick guide, will be community-based crime intervention and supporting domestic violence facilities and services. And I do want to add too that we'll have speakers in part B that will really focus and drill down on how they accomplish this in their grantees, with their grantees and in their communities. So the community violence intervention programs applies a localized approach to violence prevention. And it focuses on establishing relationships with people, like Chris had mentioned, excuse me, with people really at the center of gun violence in their communities, to focus on bringing down homicides and shootings. These programs support people at the highest risk of being victims or perpetrators, or both, of violence. And one such example here is the Operation Ceasefire in Boston, Massachusetts. This program had originated in the 1990s, and it's a problem-solving police strategy that seeks to reduce gang violence, illegal gun possession, and gun violence within communities. The strategy involves analyzing violent incidents and trends to identify those most likely to either commit or fall victim to violent crime. And once identified, individuals are invited to call-ins where law enforcement, social service program providers, and community members convey the message that the community wants them to be alive and safe and out of prison. But the shootings must stop. And at the end of the call-in service, call-in service providers offer case study management, access to mental health services, and other long-term support services. The prevention strategy is really centered on an ambitious communications campaign involving meetings with both community members, community groups, and gang members. And ideally, these activities would also be combined with a variety of other law enforcement strategies and grassroots community initiatives. The other strategy discussed here in the quick guide and on our slide deck here is the support of domestic violence facilities and services. And over the past 10 years, Sanctuaries for Families in New York, which is one of the largest victim service centers in the city, has implemented a workforce development program called Economic Empowerment Program that works exclusively with domestic violence survivors. From fall of 2019 to summer of 2020, the Urban Institute conducted an evaluation of the program. And their interim findings suggest that after 4 months of completing the required modules of the program, clients not only improved their skills attainment and job readiness, but were able to address critical barriers to employment, such as safety concerns, low self-esteem, and lack of confidence in career outlook. Moreover, researchers found that clients made meaningful connections with survivors and with each other, thus helping address the social isolation that survivors often face. And we are all pretty much isolated right now. In part B of our discussion, we'll be joined by panelists that will go into greater detail about housing and supportive services for gender-based violence and survivors of domestic violence. And when implementing a community-based intervention strategy, grantees can tie back to have the CDB tie back to identify a local strategy, a local study or data showing that COVID-19 increases incidence of community violence. And I'll be going over some resources too later as we wrap up our conversation on where you can find such resources items. And then the eligible activity and national objectives, public service, and LMC or LMA. And for domestic violence facilities, similarly, identify a study or local data showing that COVID-19 increased incidence of domestic violence. And the eligibility and national objectives would be public services and LMC. So while these slides are going to be shared on the HUD Exchange after the conference, I want to go over and all of our resources and references are documented in this, this website, in this presentation. I want to share a couple of websites that I found very useful to find programs, different programs and case studies and evidence. The first is What Works for Health. I found this a very helpful program, helpful website that actually can filter over 462 different policy programs. Although it is for Wisconsin, the state of Wisconsin, great job, by the way. It can be used throughout the country. Many of these programs are identified, whether they're evidence rating, the community development professionals, or what community members are necessary, who are the decision makers. And you could even filter down and go down to, and I will scroll down quickly, and go to community safety, prevent neighborhood crime and violence. And then going further, and you could actually see the description, evidence of effectiveness, and implementation as well. Another site that I found very useful that I wanted to share was from the National Institute of Justice Crime Solutions. You can filter through, and this is worldwide. I found other programs throughout in other countries, in England specifically, especially, that have implemented community crime prevention programs and practices. And here I have already selected crime and prevention, and you could click down on the type of program. So if you want to find community crime prevention through the program, it'll filter through, and then here you'll have several programs. And we'll just click on one for an example, and I want to show you the great detail that this has. On many of these, as you go through, you'll have the summary, the description, as well as the cost, which is so important for grantees. How much did that program cost for other grantees or for other jurisdictions? Take this with a grain of salt, because not all of it has cost, though. I did pump that up. But you can find some that do have cost. You can also find the implementation information, so you can even contact the organization or the community that implemented this and get that information from them. And the other one to find local crime in your area is through the FBI, through their Crime Data Explorer. And you could filter this by state or by types of crime as well. I thought it was a very helpful website to find crime and crime statistics within the neighborhoods.
Orland, if I can just interject, we will be posting the links to all of these sites in the chat.
We can. Yeah, I will post all these links. I'll copy and post all these links in the chat. But to further our conversation, I wanted to open it up a little bit for Q&A before we introduce our next speaker.
Great. Orlando, we've had a number of questions that have come in, and we'll start to go through those again. If you do have questions, please go ahead and add them to the Slido app at the bottom of the viewing widget. The first question that we received was how do you go about physically improving a neighborhood to reduce violence without gentrifying it to the point where it actually exacerbates conditions for violence in lower income communities? This is a great question, and I think as planners and community development specialists, something that we wrestle with and need to work through all of the time. I think, to me, and I think we can ask this question of our panel as well, where I begin in thinking about that is really focusing on community engagement and getting buy-in and support from the residents who are in that neighborhood or in that community that you are targeting, to make sure that what you're doing is what is needed for them, and also using that as a mechanism to hopefully be limiting the gentrification that can be taking place. And then the second, component that I would think about is how can you leverage your activities around reducing violence with other funding activities that might be preserving the supply of affordable housing in a neighborhood, or providing other resources to try to limit gentrification that could be taking place.
Yeah, Chris, I would also add, if I can, when connecting with a community, I think it's really important and vital to understand the barriers that community members have. What can be the issues? For example, if a neighborhood starts to increase their property values, property taxes may also increase for elder citizens or those on fixed incomes. So what can the city address or the municipality address to prevent people from having to sell their homes because of those issues? So I think really it's very critical. I think completely agree with Chris that on that community connection and trying to understand their buy-in, but also what are some of the potential barriers. And thinking about things through a policy lens too. What are some additional policies that municipalities, cities across the country have developed and improved? DC, where I live, has had has always been going through, neighbors have always been becoming gentrified. And there are constant changes to policies or added policies to try to help mitigate that and help prevent people from having to move out of the neighborhoods, not just homeowners or residents, but also businesses.
Great point. Thank you, Orlando. The next question is, what does it look like to fund these types of things? How would we start? Do we partner? Is there a special budget, or does it come from our current funding? This, I think, we'll answer here. It is also a great question that we will make sure we ask our panel, both in a few minutes in our panel at 11:15, to understand how each organization thought about funding, because I think each entity thought about it a little bit differently and found a solution that worked for them. In terms of a special budget, there is not a special budget. It would be coming from your existing funding, which could be your CDBG or CDBG-CV. It could be other CARES Act or rescue plan funding that you've received, or other funding sources that you have. But we're not talking here about a different earmarked budget just for community violence through HUD programming. In terms of how would you start and where do you partner? I would begin by gathering feedback from your community, from your residents, from your nonprofits, from your stakeholders, in understanding what the needs are that they are seeing, and then understand, are there opportunities to be partnering, and that partnering may be leveraging funding, right? There's some interventions here that we've talked about that could be relatively costly if you're rehabbing a mental health facility, or if you're building a community center. But there's also some opportunities that may be a little bit more affordable. It could be putting up temporary barriers in streets. It could be opening up a street in your commercial quarter to be pedestrian access only, or partnering with law enforcement and social services and other entities in thinking about a cohesive response to substance abuse. So I think there's a lot of different ways that you can look at it. Some interventions can be costly, some can be less, but I think it can also be an opportunity to understand what's feasible with your partners.
Thanks, Chris. I also wanted to add too, in terms of financing or funding the programs, earlier I mentioned that the White House initiative was looking across 5 different agencies to leverage over 26 different programs to address violence intervention programs. So I would look into what agencies within my municipality, what agencies within my region are leveraging, what funds are being leveraged to address that, and try to combine different sources of fundings.
Yeah, great point, Orlando. Thank you. A couple of comments of additional programs to think about. Thinking about programs related to human trafficking, or a program to help expunge or to have records sealed. These are all kind of great ideas. By no means did we intend to be the end-all be-all of program ideas. There are so many different ways that you could be thinking about how you address community violence in your jurisdiction, and what you should be doing. I believe the last question that we have is how to introduce mental health or substance abuse services within communities that are already heavily influenced by stigmas associated with mental health. And I think here, kind of in thinking about this approach, can be a very valuable opportunity to make sure that you're partnering with the correct stakeholders in engaging in trauma-informed care, in how you're introducing and designing the programs to make sure that those programs are fitting the community kind of in the best manner. I don't know, Orlando, if there's anything you'd like to add?
No, I think you've covered it all, Chris. Thank you so much.
And then the last question we have before we turn it over to our first panelist discussion. And again, please keep your questions coming in. We'll have more time at the end of this morning, and then again, kind of at the 11 o'clock session to be answering your questions. But how are data, reports, and studies on violence not an administrative cost? And that those costs would need to be admin. I think that really depends on the exact nature of what the planning, what the data, what the study is. And I think if you do have questions on that, can definitely be something to consult with your field office on in thinking about what costs would be considered admin and what costs would be considered an activity cost. And I think with that, those are our questions, and I will turn it back to you, Orlando.
Thanks, Chris. Thanks, Chris. Now we'll introduce Susan Au, Senior Planner of Tarrant County Community Housing and Development from Tarrant County, Texas. I'm going to share my screen.
Great. Thank you very much, Orlando. Like you said, my name is Susan Au. I am the Senior Planner and Special CDBG Projects Manager for Tarrant County, Texas. So Tarrant County is a large urban county. We have about 2.1 million people with 2 large cities. Now, most of the services are within those 2 large cities. The first city is the city of Fort Worth, and they have 874,000 people. And then the city of Arlington, they have 395,000 people. So you can imagine most of those services are within those 2 cities. So our office for Tarrant County, we receive HUD funding to serve those remaining smaller cities within our county. Both cities, Fort Worth and Arlington, they receive their own HUD funding, CDBG, Home, ESG. But us planners, we all communicate with each other, and we know what we're all doing and making sure our resources are spread out amongst the agencies that we all share within the county appropriately. So I was invited here today to talk about what's working during COVID using HUD funds. We received $6.4 million in CDBG-CV allocations, but usually annually we get $4.2 to $4.4 million for CDBG to serve those smaller cities outside of Fort Worth and Arlington. So how have we engaged kids to decrease community violence? Aside from rental assistance, park projects, and public facility improvements, I'll talk about two specific programs. And the first one is Safe Schools program. It was actually a pilot project, a public services project funded by CDBG in 2012, so 10 years ago. This program started after our domestic violence agency saw the need to do more prevention. So this program pays for Safe Haven of Tarrant County to go to eligible schools to educate elementary, middle school, and high school kids on anti-bullying and dating violence in high school. Now, each year since this program has started, they have assisted approximately 2,000 unduplicated kids every year, using only $42,000 out of CDBG annually. Now, it's not very much. They go to our schools and our smaller cities, and whereas we do work with Fort Worth, they have also received CDBG from Fort Worth and Arlington to do the same program. So we all talk to each other. It's really great. So from this CDBG project, pilot project, Safe Haven has gone after some Department of Justice funds, like the NIJ example you just saw earlier. So they received about $1 million for the same program, focusing on one city that had a high rate of domestic violence. So in 2018, Congressman Granger, she asked our office to go after some more DOJ money, which we did, and that addressed violence prevention and mental health in schools. So we went after those funds and we got $500,000 out of that. Half of that is to extend the program for this CDBG program for safe schools to reach those other schools that are not considered low to moderate income. So how the program works is Safe Haven has provided a new list annually of eligible schools that have at least 51% low and moderate income students. The program is qualified under presumed benefit, and they work with this individual schools to see if the school is interested in having this anti-bullying program. So it's a series of 7 classes, and if the school wants to shorten it, they cater to what the schools need. The classrooms, the kids are taught about bullying, what to recognize, how to address bullying, and what to do as a bystander. Sensitivity to the politics of having COVID or being vaccinated, whatever the hot topic in the news is, especially for middle school and high schoolers, that's how they incorporate that in with their lessons. So just to watch the engagement, I did monitoring for all 3 grade levels, and it was just fantastic to see the engagement in the students at the different levels using very specific examples catered to that age group. For example, using Lego Ninjago for the 9-year-olds versus talking about having conversations about dating violence in high schools, middle school about teasing and what's appropriate, what's not. So this was CDBG. Now, how does this work with COVID or CDBG-CV? Safe Haven applied for CDBG-CV funds to educate teachers and parents on the same program. So rather than focusing on kids, we're moving to the adults. So we wanted the adults to recognize behaviors and appropriately address potential violence, especially during times of COVID. Unfortunately, we could not find a way to meet the national objectives. So Safe Haven didn't think that the teachers would income qualify, and parents would not want to fill out any forms regarding income. So even self-certification forms. So unfortunately, we couldn't fund them under CDBG-CV, but because our department, we work with all the other departments in our county, we said, hey, there's treasury funds. So we talked to that department, passed on the proposal, and I do believe they will get funded out of the treasury ARPA funds. So it's fantastic. The teachers it's been going on for 10 years, so obviously it's working. The teachers are requesting for a Safe Haven to come back and do the educational program. They see student bystanders standing up for those being bullied, and that herd mentality of what is right and correcting what is wrong is working in this program. So the second project is working with the Boys and Girls Club. Next slide, please. Thanks. The second project is working with the Boys and Girls Club of Greater Tarrant County on the Mobile Basic Needs Bus, or they call it the Mobile Clubhouse now. And the Boys and Girls Club of Tarrant County have 13 clubs at fixed brick and mortar buildings. Like I said, most of the services are in Fort Worth and Arlington. So they have 3 vans for their mobile clubhouse, and they were donated an RV. So they had the funds to modify the inside for their needs, but needed assistance to staff and run the mobile program. So they applied for CDBG-CV funds, and the RV was funded to go to locations with limited resources and without any of those brick or mortar places these kids could go to and have a program set up. The bus would go to parks, or they'd go to the parking lots of partner agencies, public housing authorities, community organizations, and churches to provide resources and support. So the mobile clubhouse, the RV is that in the picture that you see there. The mobile clubhouse is open to members during the crucial after-school hours and the summer, and during the summer, to kids that may lack access to food, parental support, whether they're working or because of COVID, and provide healthy, supervised activities in a safe and socially distanced manner. Now, when they first applied, they said they would serve approximately 425 youth for the year. But so far, they've served 200 to 400 youth every month. So they are currently revamping what they're doing to adjust to the needs and demands that they see in our county and the different locations that they're going to, as well as reaching out to more partners. It really has been really quite fantastic to see. So this program is qualified under limited clientele, and each person goes online to sign up for this program, and they will fill out limited clientele self-certification income forms, and everybody's income qualified, or at least 51%. The majority, about 90%, probably even 95%, are low to moderate income persons. So they often have different agencies come and join them as well to provide additional resources for the parents. So while the kids are getting meals, they are fed there, they're also provided access to technology and supplies to expand on their academic success, and such as STEM kits. They have STEM kits, and they bring out tables. Everybody gets to do a project, as well as physical activities. Meanwhile, while the parents are there, it's a captive audience, so the food bank comes along and they provide food resources for them, as well as sign them up for any food stamps should they need it. So other agencies like Public Health, they have joined them as well to provide PPE supplies and just information on vaccines and where to get tested. So it really has been a great collaboration. A lot of agencies will say, hey, can we join? Can we provide this or that at your site? And so they've been very accommodating and open to work with all the agencies. So let's see. To wrap up, Tarrant County's strategy here is to provide an outlet for kids to be kids again, provide the additional support for parents to help with their kids' schoolwork, and give them a break for a bit. We go one step further and maximize our resources by collaborating with different agencies and different departments within our county so that we can serve the same population. Whether educating our kids by giving them the tools to navigate uncertain times or providing food and fun educational programs, what greater way to provide relief of COVID anxiety and resiliency than giving normalcy to our kids so that they can grow in a healthy environment? Thank you again for inviting me. Any questions?
Susan, thank you, so much. A couple of general questions that I think you came up in the beginning, in the first half of the presentation, that I'm wondering if you can talk to. First, kind of thinking about the partnerships that you formed kind of with the different programs. How did those partnerships come about? I know this program's been, the Safe Haven program has been around for a little bit now, but how did those partnerships come about, and then how have they been maintained to continue to promote the program?
All right, so in our department, we have all the HUD grant programs in our department, so which includes ESG. So ESG's Safe Haven worked mainly with ESG at first, and we were providing them with money for their shelter operations. And as we progressed and we go to the same meetings, they said, we're really trying to start this program. You think you may be able to help us? And it's like, oh, we like that idea. Let's give that a go. So we tried it out. They did well. They expanded on it, and then just kept up with it through the years. We monitor them every year. We stay on top of all their data, and they've been good. So it's been a good partnership. A lot of our partnerships have been that way, where we either have met them through other programs or through the county judge, commissioners. They would say, hey, this agency or this family needs assistance. Do you think you might be able to help us? It really does help that our county public officials know what HUD is and know how our programs work and what they're there for.
Great, thank you, Susan. And I guess thinking about the interactions kind of with your elected officials, how do you maintain the engagement, the support for this program, and what questions do you get? What do you do proactively? I guess what would be some takeaways that you would like to share with everyone listening in on how you navigate those relationships?
It really is about communication, being able to say, hey, these are the needs in our community. How can we help or fix this issue? So we really do all sit at the same table, and then the tables move around, but this conversation still keeps moving. I mean, you talk about mental health in your previous presentation. We worked on mental health. The police department actually came to us. They said, okay, we need assistance in providing a place for these mental health clients. And how can we fix this? How can we provide them with help and not just jail them? So we worked on that for years, and it's been different groups, that mental health stigma. Well, the more conversations we have about it, the less stigma there is. And so there, again, the conversation with the different agencies and the local governments.
Great, thank you, Susan. And then shifting a little bit, you talked about the amount of data that you've gathered kind of from the project over the course of time. Can you share a little bit with what you've done with that?
Right.
With that data, and thank you.
So with the Safe Haven Safe Schools program, they collect data. They do a pre-test before they start, and then they do a post-test. Then they do an assessment at the end of the school year, which happens to be the end of our grant year. So it's been great to see their numbers. They take meticulous data numbers because they are trying to accredit this program nationally. And they are on that path, and it's a long process for them, but they are on that path. So they too have to collect data for themselves. When it comes to qualifying and meeting the national objectives, we require all the programs, especially for limited clientele, to submit all the data. So we provide them the forms up front to say, hey, if you want to do this program, this is what you need to provide us. Can you do it? If you cannot, then we cannot fund you. So it's just very open communication.
Great. And then just, Susan, a couple of more questions that I had in hearing you. If you were to do it all over again, what would you have done differently? What would you have changed? And then, if you were to do it all over again, what did you do that you would make sure you did again?
I think we have done things correctly, and, you have to be flexible, somewhat flexible. For example, with the Boys and Girls Club, with COVID, things have changed fast and the needs have changed. Luckily, it's a mobile unit and that they can move around. But even with that, they have to change a little bit programmatically, but that's within their workings. Now, we stay limited to, these are the HUD requirements, so this has to be satisfied. But contracting wise, we're open to make any contract changes as long as HUD regulations are still satisfied. We're good to make those changes. So you have to be flexible. But otherwise, we wouldn't do anything necessarily different. It's because it's a pilot project for both instances. It's a learning process. If it doesn't work the first year, then I would have stopped.
Great. And we're getting a few questions coming in from participants. There was one question about the use of presumed benefit. Presumed benefit, is where you're assuming that the clientele is generally presumed to be principally LMI. This may include abused children, battered spouses, elderly persons, severely disabled adults, homeless persons, illiterate adults, or persons living with HIV/AIDS, and migrant farm workers would be the presumed benefit citation, or the presumed benefit categories. And the citation, we will make sure to put into the chat for everyone if there are questions. Julia or Gloria, anything that you would like to add to presumed benefit before moving on?
Hi, this is Gloria. I know you can't see me. When you talk about presumed benefit, what you're talking about is one of the limited clientele national objective categories found at 57208A1. This is what I get from memory. A2, I'm sorry. A2, my apologies. Little I, big A. And it lists who the members of the presumed groups are. There is a term in there. Yes, that's correct, Chris. And there are several groups that are presumed to be LMI. Note that the regs have not been updated for quite some time. So you may find some older terms in there. But specifically, they are abused children, elderly persons, adults meeting the Bureau of Census definition of severely disabled, the homeless, illiterate adults, and illiterate adults means illiterate in their own language, whether that's English, Spanish, French, or whatever it may be. Persons living with AIDS and migrant farm workers. Oh, and last but not least, it says battered spouses here, but we use the term now victims well, I don't want to say victims, but, persons experiencing domestic violence, dating violence, and stalking.
So my apologies, I envisioned my IDIS screen and it's either presumed benefit or location of services. It's location of services that we are qualifying under limited clientele. So,
Okay.
yes.
Okay.
So
Oh, I'm
because
sorry. Okay, but see, I'm looking at the word and I heard someone say presumed benefit. And when I see presumed benefit, that tells me that we're talking about the members of the groups that are presumed to be
Right.
LMI.
Right.
But nature and
Sorry,
location.
and I did say presumed benefit, but it's actually location of services. My apologies.
Okay. Oh, that's okay. That's fine. It's just that, for us, presumed benefit has one meaning and it may have a different one for you.
No. Same
That's
meaning,
what
same
it
meaning.
means.
Nope. So we use
Okay.
location of
Okay,
services.
yeah, but nature and location is being used more during the pandemic. It's easier to use during the pandemic and for CDBG-CV versus regular CDBG, where for regular CDBG, the service areas were usually those near or limited to public housing complexes. For example, a tutoring program that only tutored the kids that lived in a certain complex. But now you just have to be able to show that the nature of the activity, which is usually a public service, its nature and its location, where it's being carried out, will identify the areas meeting that national objective, which means that it's usually 51% or greater LMI.
Yes. And all of our schools under Texas Education Agency, they are at least 51% low to moderate income. Most of those schools served are closer to 70% low income.
Okay, because unless a grantee is what we call an exception grantee, which are a lot of times are counties, but can be cities where they have a very low LMI percentage.
We used to.
You did?
We
Okay.
used to. No longer.
Okay. Okay. Well, I just want to point out that, except for the exception grantees, it has to be 51% or greater LMI. And that can be proved with census data.
Yep.
Yeah, I also want to point out that I've heard, I've been listening, but in some areas where you have, more issues, you may be able to get some crime data as well to show an increase.
Oh, okay.
When I look at this youth services, there are some schools, even in this area, since they've opened back what we call in-person learning, they're bites daily. And those areas are probably experiencing more poverty and more problems, than a wealthier area, hence the violence, among the students. So a program like this, youth services one would be a great one for areas like that. And in school systems like that are experiencing a exceptionally high number of fighting among the children.
Yeah. So the national objective, just to confirm, is LMA, low income area benefit. And, for the audience, I always find going to your IDIS definitions is very, very helpful. With a quick control find, you can look up things very, very quickly. But I think we need to move on. This is fantastic clarification. Thank you, Gloria, and thank you, Susan. And maybe Orlando, I don't know if you want to take over from here.
Sure. Thank you, Susan. Thank you, Gloria and Julia and Chris. That was a great presentation. Really appreciate you, Susan, for taking the time and being with us, joining with us today, and sharing the experiences that you're having and the wonderful things that Tarrant County, Texas is doing. We really thank you for your time. Before we wrap up, I do want to share screen again and just kind of go over the community violence intervention tool, or excuse me, quick guide that is posted on HUD Exchange. The document itself, if you do go through HUD Exchange, you can go through resources, CDBG-CV Community Violence Intervention Quick Guide, which was published in 2021, and identifies the different strategies that we discussed today, such as improve physical environment of neighborhoods, increase financial stability and mobility, engaging and support youth, and then you could just download the PDF here. I also want to recap. We talked a little bit about finding data in your areas. The great tool that the FBI has on Data Explorer, our Crime Data Explorer. And then this was shared in a link to the group, to everyone on all the audience members. It is a great source and tool that you could use to help you as you develop your plan. And I do want to reinforce, we did share links to some great examples nationwide of policies and programs from What Works for Health, that is shared through the University of Wisconsin Population Health Institute, School of Medicine and Public Health. That is a great resource, as well as what was shared earlier through the National Institute of Justice Crime Solutions. And you can filter through topics on crime prevention and community crime prevention and related programs and practices. So I want to thank everybody for joining today. Chris, do we have any more questions that we think we can address today, or after hours, or possibly even with the next session?
There are 2 questions that I'd love to keep for our panel at 11:15. One talking about best strategies for teen programming and examples of how funding has been leveraged.
Great. Well, thank you, everybody. We appreciate you joining us today for our session, Part A. We look forward to everyone joining session Part B, where we'll be joined by panelists to discuss what they're doing in their communities with their grantees, and how they're working in communities to try to mitigate violence. Again, that starts at 11:15 Eastern Standard Time. It goes until 1:15 Eastern Standard Time. We'll be joined by Chanel Smith, City of Los Angeles, from the City of Los Angeles, Jen Schuman, former acting director of Housing Stability Division for Salt Lake City, Elizabeth Fitzgerald, executive director of Clark County Volunteer Lawyers Program, as well as Jim LeBlanc, who is a survivor support attorney, Elizabeth Macias, program manager in Economic and Workforce Development Department from City of Los Angeles, and Greg, along with Greg Erickson, REDIF Director of Government Partnerships and Policies. They will be going over some great case studies and examples of what they're doing in their communities. And we look forward to having that conversation with them and with you all. Thank you for joining today's session.
Orlando, I'm sorry if I could just interject, just had one clarification we wanted to make on the project that Susan was describing. The national objective was not LMA, it was limited clientele using nature and location which is 570-208 A2ID.
Thank you, Chris.
Sorry.
Yeah, no, my apology too. And just to also remind the audience that we will be meeting with the 4 panelists at 11:15 a.m. Eastern time. So you will hear from 4 panelists in the next session, and we will have questions between each of the panelists that present, who are CDBG grantees that'll share their programs that they've been managing and funding. So 11:15 a.m. Eastern time.
Thank you, everybody. This concludes our session for Part A.